In 2013, Typhoon Haiyan devastated parts of the Philippines, with Tacloban being the most severely hit. 4 years later, Tzu Chi's assistance continues. Each year, a team has held free clinics in the area. This year, the event was held at Leyte Progressive High School with the help of volunteers from Singapore, Taiwan, and of course, the Philippines. An air conditioner and plastic tarp is added to turn this classroom into a surgical station. A few wooden poles and canvas provide the privacy an OB/GYN patient needs during her appointment. Chairs, when combined, become a table for acupressure. This team of free clinic takes place inside a school, and volunteers quickly divide the classroom into 7 departments: internal, external, pediatrics, ears, nose and throat, eyes, and dental. This patient, who is on the surgical table, is finally removing his sarcoma of 22 years.
I thought of going to a doctor to remove it, but as it didn't hurt, I just forgot about it. I thought about surgery, but didn't have the money. After he tried to remove it, the wound became infected. When it healed, it later turned into a cyst.
Going to the doctor when one is sick is often the solution, but for many of the Filipinos, it's not their first option. At the dental service station, normally it takes only a few minutes to pull out a tooth. However, this dentist takes more than the average time for each patient.
Normally, we just pull out the teeth with cavities. However, after so many free clinics, I've seen that these children suffer from severe cavities.
To save the children's teeth, these dentists would rather spend the time to treat the problem. Doing a root canal takes half an hour, but this child needs 4 done. In total, the doctors spent 2 hours working on one patient. One root canal cost is 3,000 pesos, and 4 would amount to 12,000 pesos. It's really not something average families in the Philippines could afford, and this is why the free clinic team insists on offering their services. Over at the pediatrics department, this mother has brought her 4 children to the free clinic. Their illnesses have not been looked at, as it cost the family 300 pesos for one doctor session, which is how much her husband makes in 2 days. This is why she didn't seek medical treatment unless it was for free.
She has gastrointestinal bugs. It's very common in these parts.
At the other medical department, a husband and wife pair has brought their son to experience the free clinic overseas.
We wanted our son to understand what his parents do while volunteering.
Acupuncture is something these residents haven't seen before. This doctor's way of diagnosing a patient's ailments is from the ears.
He has rheumatism. His entire body is hurting. There are many like him.
This free clinic isn't at a comfortable room with an air conditioner, nor payment for the services. It's simply filled with a team of dedicated doctors looking to provide the best medical services for these patients.